Perfect. Well, again, thank you so much for being with us tonight for the UC College of Pharmacy Town Hall. We're so thrilled to have so many of our alumni and community partners with us. So first off, just acknowledging the special guests, we have college advisory board members, distinguished alumni, alumni council members, and some faculty and staff. So we truly appreciate you and your interest and your support of the college. So the main way we're going to communicate with one another tonight, if you have any questions or feedback, is the chat box. Make sure that you have it on everybody, on the everyone setting, so we don't miss any of your questions. So feel free to ask questions during Dean Mack's presentation and hearing from our alumni, and then we'll address those questions during the Q&A session after they've all spoken. And then, so first we'll have Dean Mack talking. We will then hear from Mimi Hart, Emily Young, and Christy Barr, 3 of our alumni who are experiencing this on the front line, just like so many of you are. And then after that, I have a couple questions that were submitted ahead of time, so we'll address those after questions from the presenters immediately are answered. We're going to try to end on time at 7 p.m. If there's anything we don't get to, we can talk offline and answer any questions that we didn't get to talk about. And as I mentioned earlier, as we were all connecting, if you're having any IT issues, I know we think some people are experiencing audio issues if you're going through the app. Lori McDermott's available. I included her email in the details email I sent yesterday. You can also access her directly in the chat feature if you're able to connect to chat but not audio. So Lori is here to help us. We really appreciate that. So before I turn things over to Dean Mack, I just want to thank you. And as we try to navigate what alumni engagement looks like in this new world of ours, I would love to hear more from you if you have any ideas or thoughts about that, what you've seen from your experience with your organizations, with your businesses, with your companies, and we'd love to hear any ideas you have since the future's a little uncertain with what in-person events could look like. So we appreciate any feedback you might have to connect with us. Just one final reminder, we should have had everyone on mute upon entering, but if you could just double check to make sure you're muted. We just don't want any feedback or disruption for our presenters. So with that, I will turn it over to Dean Mack.
All right. Well, thanks, Bree. You guys hear me okay? All right, very good. So first of all, I just want to thank you all for joining us this evening. You know, when Bree, Brian, and I were planning this, you know, as a virtual event, we weren't sure how many people would show up. Certainly, we would have still done this even if only one person had shown up. But I think the response actually, to be honest, has been really overwhelming. We've been really pleased by that. So thank you for spending an hour of your evening with us virtually. I know actually I recognize a few of you actually just, I was on a previous call recognizing outgoing CEO of APHA, Tom Menahan. So I think a few of you are part of that virtual goodbye as well. So we're kind of doing everything virtually. And as Bree mentioned, this is something we wanted to try just to give you an opportunity to hear about what's going on with the college. And part of this too, I was really excited about the 3 alums that are going to be speaking after me, kind of sharing in 3 different practice settings how they're facing and dealing with COVID-19. First of all, I just want to give a special thanks to each one of you who either you're providing direct patient care or maybe you're managing or in a corporate position. I know this has definitely been a stressful time for our profession. And I guess if there's anything good to come out of COVID-19, I think pharmacists really have risen and our profile has risen a lot. I mean, we've gotten a special shout out from former First Lady Laura Bush in one TV show. Pharmacist was interviewed on Live with Kelly and Ryan. And I think just the news yesterday, right, about extending COVID-19 testing status to pharmacists across the country. I think we're really showing the public and decision makers what we can do. So that's been, I think, a really nice kind of side benefit, perhaps, of this pandemic. Before I get into the specifics of COVID-19 and how our college is kind of dealing with it, I did want to just give a couple kind of highlights of this year. Even though the academic year certainly did not end the way we wanted it to, I didn't want to lose sight of some of the accomplishments. So very quickly, our college won again this past year the HEAT Award. The HEAT is the Higher Education Excellence and Diversity Award. So the past 2 years we've won that, the only pharmacy school to win both 2018 and 19. And earlier today I spoke with Pat Aco, who's leading our submission package for 2020. So hopefully we'll make it a three-peat. The U.S. News and World Report rankings came out in March, and so for pharmacy schools, they come out every 4 years, and so we jumped 3 places, passing 5 other pharmacy schools, so from 33 to 30. So that'll be our ranking for the next 4 years. So it's nice to be among the top 30. There's almost 150 pharmacy schools now, so I think to be in the top 30 is definitely an accomplishment. This past year was our record year for research funding for our college. And kind of a neat metric I want to share with you is that if we look at our tenured or tenure track faculty, on average last year in new funding, they received over $200,000 per faculty member. And that actually was the highest of any college at UC, higher than medicine, higher than engineering. And so while we're small in size per capita, we're definitely punching above our weight. Earlier this spring was the ASHP residency match again, and if you might be familiar, there's 2 phases in that. And so if you look at our match rate at the end of the second phase, we were at 88.2%, so among the best in the country. And so it's always nice to see many of our P4 students go on and do residency training. And then lastly, this past semester, actually, we set a new enrollment record for our college at a time when many pharmacy schools are struggling with enrollment. Because of primarily of the strength of our distance learning programs, we actually set a new enrollment record. So again, I didn't want to lose sight of some of the good things that happened just before the pandemic struck us. So let's kind of go back in time, if you would, to about mid-March. And if you're like me, the days kind of bleed together. So I know today's officially May 21st, but I'm not sure really when it is. I've actually got the headsets on too, because if you're like me, probably your personal life has changed too. We have 3 teen daughters that have been doing remote schooling, and a dog that's gotten very attached to me being home the past 2 months as well. So a lot of changes, I think, professionally and personally. But if we think back around mid-March, when COVID-19 really started to impact our country, UC actually moved to remote work, remote research, and remote teaching just before spring break. So actually, I remember that day very well. I called an emergency faculty and staff town hall. I said goodbye to our student council president, and we packed up and left. It was a very surreal feeling. I know some of you that work more in a corporate setting, you've had kind of the same experience as well. And so after spring break, after that period, for the rest of March and into the month of April, then we switched to remote teaching. And I have to give a special shout out to our faculty and staff. I know we've got a couple of faculty that joined in tonight on the call. It was a huge transition. I mean, in some ways, certainly we did have 3 distance learning master's programs already at the college, but to move the entire curriculum and essentially in about 1 week prep time to a remote learning certainly was a big lift. And we had some fantastic support staff, John Lawson, Nick Lotz, and Joey Lyons behind the scenes really helping the faculty. But it really, from my perspective anyway, it seemed to go very seamless. We actually checked in with each class along the way, how things were going. We did town halls with them, and the feedback was very, very positive. And of course, our students, I think as well, they deserve a shout out. It was a big transition for them. For our P4 students, definitely not the way they anticipated the last month of their experience at UC. Fortunately, we were able to kind of work with our practice partners. All of our P4 students finished all their rotations. Some of them looked a little different by the end of March, but they finished them all. They finished their capstone course in the month of April, and they all graduated on time. So that certainly is an accomplishment. Myself, I had 2 master's students this semester, and both their capstone presentations were virtual, but they certainly did graduate. As far as graduation ceremony itself, as you know, our college, we do our own ceremony in addition to the university one. So both of those have been postponed. Tentatively, we're hoping to do a college ceremony the same day as White Coat at the Aronoff in late August, but that's really contingent, of course, on kind of state rules as far as how many people you can get in a space together. But that is our tentative plan at this point. And certainly once they're finalized, we'll let you know when that event happens. So over the summer then, kind of what's been going on, well, UC actually switched to remote teaching for the entire summer. Now, certainly we don't have a whole lot that's taught in our college, but some colleges do. And UC actually set a record enrollment this summer. We were kind of expecting an enrollment drop, but UC actually has set a record enrollment this summer as we've moved to remote teaching. As I mentioned, we've continued to move to, or we've been in remote working for about 2 months now. And it's been different. I think, you know, those of you that have experienced something similar, it can be challenging just to make sure that your coworkers are engaged, that everyone's kind of feeling, supported, not isolated. And so we've done a lot of things. I've continued to have faculty meetings in the summer, something we usually don't do at the college. We had one this week. Staff town halls. I have another one planned for next week. We also did a town hall with our graduate students, our PhD and master's students, of course, that are year round. We're going to do a second town hall with them as well. We do have our new P4 students that started rotations on schedule in the month of May. So we were a little bit worried there for a while that perhaps those rotations could not proceed, but they have. Now they look quite different. Many of them are virtual rotations. We've made a few exceptions. So for example, if a student is already an intern in an organization, sometimes we've allowed those rotations to continue as they usually would. But many of them have really become virtual. And so I know we've got some practice partners on the call tonight. I just want to give you a special shout out and thank you as well for helping us with that. For June, we're going to kind of play it by ear, but it'll probably be more of a hybrid. And then we're hopefully by July to be primarily back to kind of our usual in-person direct patient care rotations. The research enterprise of the college, as you can imagine, research also look quite differently, where many of our researchers have labs, they have lab staff. There's a few researchers like myself that have virtual labs, but for most, it's really been a big change. I think Pankaj Desai might be on the call tonight, who's our chair of our division of pharmaceutical sciences, and it's been a big change for his division as they've moved to remote research. The good news is that's about to change, and so just within the last week, UC has kind of issued kind of a repopulating the research enterprise, and starting on June 1st, gradually, researchers will be allowed back at the university with social distancing, wearing masks, not at full capacity. But the idea is that over the month of June, to really get the research enterprise ramped back up. So that will certainly be, I think, a welcome move for many of our researchers. The rest of the faculty and staff, though, will actually be continuing to work remotely until July 1st. And then starting in July, the same sort of ramping up process will begin at UC. We'll probably either do alternating days or part shifts. We're not all allowed to come back the first day and crush the university on July 1st, but over the summer, gradually we'll be coming back. Of course, the big question that everyone's kind of wondering, what about the fall, right? So what is education going to look like in the fall? And across the country, some universities have already made decisions. For example, University of California system, or Cal State, has already decided they're doing remote instruction throughout the entire fall. Other universities like Arizona State and University of Arizona have already decided they're coming back in full. Certainly, it's been a hot topic. The deans, we've met twice in the last 2 weeks with the university president, and certainly have had a lot of discussion around it. He's not comfortable at this point of making a decision right now. There's still a few other factors that are kind of out of our control. I suspect, and again, this is just Neil McKinnon saying this, but I think we'll probably have some sort of a hybrid model in the fall where we'll continue to teach probably some courses online, and then others, things like perhaps like a skills lab or other labs, we'll have to kind of modify a bit with social distancing, with masks, and modify that. But again, no official decision has been made. We're hoping, maybe in the next 2 to 3 weeks to hear something definitive. But certainly, if you're a parent of a UC student, I know that's probably at the top of your mind. Certainly, it's probably the number one question as a dean that I get asked. But at this point, no formal decision has been made. We are still planning, hopefully, to do a white coat ceremony in person. Again, it could end up being virtual, but we're hoping to do it in person. Once again, I just wanted to thank those of you in the past that have sponsored our white coats. I don't know if Dick Darlington is on the call tonight or not, but he's been kind of our superstar over the years. He just tends to sponsor several of those. He just did it again. But we'll be sending information out soon about if you're interested in that. That certainly is welcome by our P1 students. Lastly, I just want to talk really briefly kind of how the research enterprise at the college has shifted as well. And I think, being part of a public university, I think part of our greater mission is the public good. And at this time, you could argue there's really no greater issue than COVID-19. And so I think many of our faculty across the entire university have switched their research programs and have now kind of focused, on different aspects of COVID-19. Our university kind of had an internal funding mechanism. Other faculty have just gone ahead, even without funding, and have switched things. So I just wanted to give a special shout out to a few of our faculty that have done that. For example, Dr. George Weber is looking at an adjuvant for a vaccine, and so he's kind of switched his research program. Dr. Bing Yan, who's our Associate Dean for Research and Innovation, he's looking at remdesivir, an antiviral, and kind of the impact of that. Again, Dr. Pankaj Desai, who I think is on the call tonight, and Gary Gadowski are looking at brain pharmacokinetics of different COVID-19 therapies as well. Myself, even, you may not know, as a dean, I've maintained kind of a small research program as well as dean. The last 2 or 3 years, really a focus on the opioid pandemic impacting the state of Ohio. And so I've worked with Dr. Anna Inkapi, who's one of our faculty in the Department of Geography for the past couple of years. And so what we've done, we've actually now taken those same methodologies that have mapped out and predicted where the opioid pandemic was spreading, and now we're applying those same methodologies to COVID-19. So we've released 2 health policy briefs. The first one was released about 3 weeks ago, and it looked at how the changes in social distancing policy might bend or shape the curve. We did a policy brief. It ended up actually getting a fair amount of local media attention. We did TV and other kind of was in the Inquirer. We also shared that brief with Dr. Amy Atkin and Dr. Mark Hurst. So, of course, I think everybody in the state of Ohio knows who Dr. Amy Atkin is. She's the director of the Ohio Department of Health. Dr. Mark Hurst is the medical director, so he's really the number 2 person, and he's someone actually that I've had a connection with previously. And so we sent the brief to both Dr. Atkin and Dr. Hurst. He thanked us and had some follow-up communication as well. Our new brief, actually, we just released yesterday. And so UC actually will be doing a news story about it tomorrow, where we kind of looked at each county in the state of Ohio and looked at the mortality risk related to COVID-19, controlling for a lot of factors such as age, social demographic factors, looking at which counties were at highest risk. And then secondly, connecting that with healthcare resources, looking at, for example, ICU bed availability in different counties. So that policy brief as well last night around 7:30, I sent to Dr. Mark Hurst again. We exchanged a few emails and will be released tomorrow by UC. So I'm really proud of how our research faculty have really stepped up. I think hopefully we can contribute to eradicating this this pandemic and really being a good public good as well. So that's kind of part of what we're doing. Finally, I would mention that as well, our college, this year we established a new research and innovation fund. We had a $40,000 lead gift. And certainly if you're interested in either contributing to one of those projects or the research of the college, we would welcome that. I think Brian Hurst actually might be sending maybe a follow-up, or certainly you could talk with myself or Brian if you're interested in supporting that. So with that, I know we're going to take questions at the end, and I look forward to your questions. At this point, I'm going to pass it back over to Bree with 2 extra minutes. That's unheard of for a dean to end 2 minutes early, but there we have it. So I'm going to pass it back to Bree.
That's great. Thank you so much. Yeah, so if anyone has questions for DMAC, feel free to put them in the chat box, and we'll address them after our alumni speakers. So the first one I want to introduce is Amy Hart. She is the CEO of Hart Pharmacy.
Hi, everybody. Thank you for joining us tonight. Brian and I had just gotten back from the OPA cruise to Hawaii when things went downhill quickly. Sarah and Eric, Sarah is my daughter who works for me, and Eric, our other pharmacist, decided that since I'm the elderly statesman of the pharmacy, that I was the backup pharmacist. So I've kind of been working in the background, trying to get all the paperwork done, trying to make sure that we follow all the policies and everybody stays safe. Of course, we closed the door to the pharmacy. Our deliveries went up 70% overnight. Really stressed our drivers. Of course, we've been delivering for 60 years for free. So it was not a change in our workflow, except that all of a sudden we were delivering almost everything, or else delivering it for curbside, people calling from the parking lot to get their, and sending people out to give them their medications. We also wound up having a lot of transfers into our pharmacy as people found that the chains were not ready for this change in workflow yet, and a lot of the deliveries were only happening next day or second day or third day, even though they were promised second day. So not only did we wind up with a lot of new patients, but we also had to expand our delivery area to take care of a lot of elderly that really needed help. We've also, been doing a lot of cleaning, been building barriers. We've had a problem with, we take care of 2 drug rehab facilities who they changed their hours, weren't available to some patients. So fortunately, Sarah and Eric are both educated in long-term injectables. They've been giving Vivitrol. They've been giving hydroxyprogesterone to people whose doctors have closed down their office. We've giving Invega. I mean, lots more shots than we're used to, because there was a need in the community for that. We had a student in March who her rotation was fairly impacted, although I think it was a good experience for her to learn how to shift quickly and learn how we were able to do things a little faster, because it was just us making the decisions and we didn't have to go to corporate for it. We have an excellent student this month, and I think she's learning a lot. She's certainly helping us a lot. We're putting her in charge of daily checking the COVID test to see which one has gained approval for use with a CLIA waiver. We're desperately trying to find tests that are available so that we can start both acute testing and antibody testing for people who want that. It's still very sparse, basically mostly just available to hospitals and by a doctor's order still, but we think in the next couple of weeks it's going to get much more available, and we're certainly ramping up for that, and thinking how we'll have the people in, or whether how we will set up the back parking lot to do that. It's been very interesting. I'm a child of the polio era. So, I talk a lot to young moms who are just frantic, especially with the new syndrome that some of the children are coming down with. And I discuss with them, how it was when I was growing up and the pools were closed and all the mothers in every summer were worried about the kids getting polio, and how I remember going to General Hospital where my godfather was a pediatrician, standing with my sugar cube and getting my vaccine on the sugar cube. So it's not that I think I have some experience, even though I was very young, but I kind of still remember what it was like to have that fear so prevalent in the community. And I really feel like part of our job as an independent pharmacist in the community has been to keep everybody calm. The first thing we had to do was explain to them that their drugs were going to be available, we were going to be available, delivery was going to be available. We've delivered milk, bread, you name it. If they can't get out, we've been helping them out. So I think, and I certainly agree with Dean Mack. I think pharmacists all over the country have really stepped up, and I'm hoping that we will be rewarded with being able to practice more at the top of our license by doing all the things that we've done throughout this pandemic. Is that my 5 minutes?
That was really good. No, I appreciate that, and it's interesting to hear from that community perspective and those relationships you've built over so many years, and for you to be that frontline caretaker for them. So, no, we appreciate everything that you're doing, and being an example of a great Bearcat out there for us. Well, great. Well, thank you so much for being here. And
absolutely.
Perfect. So our next speaker is Emily Young. She is a clinical pharmacist at Bethesda North Hospital, and she actually has some experience in their COVID ICU. So I'll turn things over to Emily next.
Thank you, Bree. So I work at Bethesda North Hospital, and I work in several different areas of the hospital. Our staffing model is decentralized, and we collaborate a lot within the pharmacy department. So I work in the emergency department and in our ICUs on our internal medicine floor and in central pharmacy normally. And then in these new times, I'm also working in our COVID cohort unit and also our COVID ICU, along with some of my peers. So it has been, everything's different at the hospital now. The feel is different, the environment is different. And from the moment you walk in the door, when they're taking your temperature and we're changing out of our uniform scrubs into hospital scrubs. So it's definitely a different feel and a different environment. It has brought a lot of challenges, but also a lot of areas for growth. The thoughts that I'm going to share are mine, and I don't represent TriHealth in any way. But I feel like this has been a great chance for us to learn to pivot and adapt and work together in ways that we haven't necessarily had to do, at least at this scope, before. So we're finding new solutions for problems that arise during this pandemic. So for example, we've adjusted our staffing model within the pharmacy. We're trying to limit foot traffic up on the patient units. So where we all used to be centralized to every unit in the hospital, now a lot of us are spending some of our time working from central pharmacy and trying to providing those clinical services, but not necessarily from the unit, to keep everybody as safe as possible and limit exposure. We're using a lot more telehealth than we used to. So we have, I call them the iPad on a stick. I'm sure it has an official name, but it rolls into the patient rooms and we can talk to the patient, which is especially helpful if they're in isolation for a positive COVID or a pending COVID, or even if they're in isolation for another reason, because then we can conserve the PPE, the personal protective equipment for the time we need it. So we're using telehealth and we're using a lot of phone calls so that we can continue to provide the really important services that we do, like medication reconciliation and discharge counseling, things like that. So we're adapting. You have to change your counseling style a little bit when you're talking through a phone and making sure the patients are understanding you and you can't see their face to know when they are or aren't listening to you. So it's been different, but we're really learning to cope with that. That's one of the hardest parts of the pandemic for me. I find with patients and those in-person interactions really rewarding. And while I'm still getting to talk to the patients, I really miss that personally. And I'm looking forward to having more in-person interaction with patients back in my day-to-day routine. But on the flip side, one of my favorite things that this pandemic has brought about has been the awesome collaboration that's going on. So within our department and within the entire hospital, and then also the support we're getting from the community and the help we're getting from people reaching out and everybody being willing to help where they can and cooperate where they can. It's hard for patients and families to be separated. So we have limited visitor restrictions right now, but everybody is really doing their part to keep everybody as safe as possible. So that's really cool to see. And then within the hospital and our healthcare teams, we're communicating a lot and we're working together to find new and creative solutions to problems like drug shortages. So we have new protocols now for help us conserve some of the use of the medications that we're the critical COVID patients might need, like sedatives and certain respiratory treatments, paralytics if they have to be prone to that, things like that. So it's a really cool opportunity for me as a pharmacist to be involved in the team and help them figure out, can we use an alternate medication that we might be able to substitute so that we are providing the best care we can to the patients we have now, but also always staying ready for the next patient that comes in. And there's this lingering cloud of a surge that we keep hearing about. Hopefully we're hearing less and less about it now. Maybe, fingers crossed, we'll miss it, but we're always trying to be ready for that. So doing everything we can now, but always looking forward. So it takes a lot of communication, a lot of teamwork. We're all doing a lot of literature reading and sharing what we learn with our peers and working together as teams even better than I think we have before. We're learning and we're adapting, and it's really cool to see that. It's definitely challenging and it's definitely different. So I am ready for life to go back to the way that it was a few months ago.
Perfect. Yeah, thanks for sharing. I can't imagine just the whiplash that it probably was, but also maybe even just kind of waiting for a surge that you hope didn't come, but just what kind of anticipation that brought to, and for all of you just interdisciplinary teams to just all hunker down and work together. So it's really great to hear that. Well, thank you for your insights and for being here tonight. That was really interesting to hear from you. So our final alumni speaker is Christy Barr. She's the Senior Vice President of Central Operations at Genoa Healthcare. So Christy.
Okay, thank you. Hello, everyone. Thank you for coming. I'm excited to kind of talk about, what we've been seeing. So I'm working in more of a corporate level, but in case you don't know, which many people don't, Genoa Pharmacy is, we have 520 pharmacies in 48 states. 95% of our pharmacies are co-located in either a community mental health center, and we have a very small population that's co-located in some federally qualified health centers. So our biggest patient population is behavioral health patients. Most are schizophrenic, bipolar, schizoaffective disorder, and we work inside, we rent lease space inside the clinic to be able to provide services. So most of our patients, once they see the psychiatrist, when they're coming out, they're picking up their prescriptions, and then we do specialty packaging for them. We do, like Mimi said, we do a lot of delivery before, but we do at least 70% more delivery than we did before. And with us being co-located in the community mental health centers, one of the biggest pieces that the challenge that we've had is I have almost 70% of our community mental health centers are closed door right now. So either they're completely not having patients come in, and they're doing everything out in the community, and they've really had an uptake in telehealth, or they are only having the patients come in for critical services. So a few for intake. Intake has gone way down, and we are also providing long-acting injectable medications and things like that to patients when the nurses are getting sick and can't come in, or whether the clinic is closed and they don't have anybody to provide that service. So I'm in Tennessee this week, and I went to 5 of our pharmacies here in Tennessee, and 3 of them were locked tight, and there are no plans yet to bring anybody back in. So I think that's a little bit disturbing on our side with the mental health, because the intakes have gone down so significantly. We even have some crisis units and some substance use disorder clinics across the country that are not taking new admits right now. So I think especially for everyone, but mental health, it's really been a big distraction and a big, it's a big barrier for them, for people who already had a lot of barriers. The things that we're doing to combat that, obviously, is a lot more delivery. We do a lot of curbside pickup. We converted one of our large call centers to a call center, not to do MTM or counseling services, but to actually do outreach to all of our patients to ensure that they're okay. find out what they need with their medications, and help connect them back with their clinics, since we're very close with the physicians and nurses in our clinics. So it's been a really different world, and especially after visiting this week and seeing some information that we've gotten from other clinics, it's going to be, some of this is going to be the new normal, and I think it's going to be some of the new normal for the summer. So I don't think telehealth is going to go away. I think those who were slow to adopt it have now adopted it, and I think as long as the states keep these emergency regulations in place or make them permanent, we're going to keep seeing that. So, you know, our staff is amazing. Our frontline staff has been awesome. You know, my goal is to keep everybody safe. So, our people, we just have to tell them, you know, be careful. If you're going to someone's house to do a delivery, make sure you're wearing your PPE and doing all those things, because we have pharmacists, technicians, drivers, and everybody out making sure people are getting their medications right now. So we're maintaining, but, you know, the growth and the behavioral health aspect is really going to be scary, I think, if we don't, you know, open things back up. Thank you.
Thanks. No, it's a really good point. I think May is Mental Health Awareness Month too. So it's,
I know.
And I think, I mean, all of us, I think in our own ways have experienced that strain, and yeah, I can't imagine your patients who have that increased need, and it's really great to hear how you are checking in on them and still servicing them, even with all the restrictions that we have, and hopefully we can adapt and still be available for them. So perfect. Thank you so much, Christy. We do have some questions in the chat for our speakers before we get to the ones I got ahead of time. So first up, for Dean Mack, from Bill Ellis, how are admission applications holding up?
Yeah, I think, you know, it's interesting, and across the entire country, of course, we have one centralized PharmD admission portal called PharmCast. And, you know, it's certainly been a challenge for our profession, the drop we have seen in that, in particular, the last 3 years. So just as an example, just this year alone, nationally, there was a 28% drop in admissions. And if you look at the last 3 years, it's been about a 50% drop. So it's definitely significant. Last year, so not this past year, but the year before that, only 17% of pharmacy schools filled their classes. And I suspect for this year, it'll actually be quite a bit less than that. So we will not have a full class in August as far as PharmD. Now, certainly we're having growth in our online programs, which is, you know, reassuring and helpful. And we're hoping to launch more of those in the future, as well as graduate certificates. We're launching a new graduate certificate with the School of Nursing next year and caring for the underserved. So we'll try to grow that way. But it's definitely a battle. Again, I would hope maybe through this, the exposure that pharmacy is getting as a profession might entice some people to think about it as a career. Again, pharmacists have really stepped up and are more visible, excuse me, than I think ever. So hopefully that will be a help. But yeah, to answer your question, it's at least right now, I think every program in the country is kind of facing this challenge.
Thank you. We actually have a question for Mimi. So do you have any comments on the accuracy of antibody and viral testing, and anything with false positives or false negatives, just anything about that whole topic that you want to?
Yeah, well, we have, fortunately, like I said, we have a student this month. So part of her job is every couple of days to bring up all the testing that's been classified as emergency, and kind of try to look through the data for us. We kind of have a little time because there's not a whole lot available right now for us. We have not made any final decisions, but it is certainly something that we are concerned about, and something that, you know, we would certainly talk with the patients about before we started, before we gave them any tests, you know, because the problem is, and what I know so many patients don't understand, is it's so much a point in time. If they haven't had it, they could get it tomorrow. And if they get a false negative or a false positive, you know, false negative could mean they just haven't built up enough titer, a false positive, might give them the thought that they can go out and do whatever they want, and that might not work. So it's Wild West out there right now.
Yeah, I did an Allied Health Town Hall last night, and people were asking about just that experience with testing, and yeah, it does seem a little.
They're from all over. We're getting, there's tests from China and tests from India, and we're trying to make that all apples when it's apples and oranges is very difficult. But I think Christy, our student, is getting a lot of experience in trying to figure out what is truthful and what is not.
Yeah, that's really interesting. So thanks for that insight. Our next question is for Emily, if you're able to answer it. Also, by the way, thanks, Gary, for the question for Mimi. So Tom Imhoff was asking about, and I'm not a pharmacist, so I don't know if I'm going to say this right. So the use of drugs for the cytokine storm, just new drugs for off-label use. I don't know, Emily, if you're able to comment on that at all.
Cytokine storm, you got it. We are seeing that. So we're trying to keep up with the literature, and there's so much of it pouring out every day. We do use some of it. I know some of the big off-label, biggest one probably is the Plaquenil or hydroxychloroquine, and some evidence came out about that, and then you couldn't find it anywhere because everybody bought up all the supplies. And we are trying to use what the literature supports as best as we can. There's not any great straight up treatment protocol, off-label or not. There just hasn't been enough time. There's awesome research going on, but it is off-label. I guess that's just the bottom line. But hydroxychloroquine and a lot of use of zithromycin. The remdesivir is a big topic right now, but it's hard to get any of that at this point in time. So, and the cytokine storm, so when our patients are coming in with a more severe, what we think could become a more severe case of COVID, or if it already is a more severe case of COVID, we're trying to be proactive about testing for the different markers that would indicate that the patient's at risk of the cytokine storm, so that we can maybe treat a little bit more aggressively initially, hopefully have better outcomes. A lot of it is supportive care. I don't know if that answers the question. It's all kind of a day-by-day guessing game.
Yeah, I can't imagine managing or trying to react to the supply and demand issues and just the ebb and flow of that. That was an interesting question. Yeah, thanks, Tom. So if anything else comes to mind for anyone, feel free to use the chat. I am going to move on here in the last 10 minutes, so we have allotted for questions submitted ahead of time. So a lot of these are for Dean Mack. So one question we had was, how are lab courses being taught right now with COVID restrictions?
Yeah, and certainly that's something I've been talking, I was on a call today with my other dean colleagues. If you think of a school like arts and science, where literally they have tons of chemistry and biology labs, how do you try to organize that with social distancing? You might have had one lab where you had 80 students together in a space. Well, now, you divide that into 4 sections of 20 students, and that for room scheduling becomes a nightmare as well. So it's a lot for us to work out. Now, certainly in pharmacy, the pharmacy school itself, really the 2 courses that really impact us the most, one would be skills lab. And I know, Mimi Hart, who just spoke, has been involved in that for years. So I think that one is going to take quite a bit of planning to figure out how can we, because there we actually, in addition to those closed spaces, we use, residents, we use pharmacists in the community. Jim Kiffmeyer, I'm not sure if he's on tonight, but, he's involved. So that one is going to take a lot of planning. The other one, we have an elective course on compounding. As well, that Dr. Mike Hagner teaches. That's going to require a bit of rethinking as well. So I don't think we have any answers yet, other than we know that we need to look at that. I think we're again waiting to figure out, how many people can we have in a space and what are the options. I would say though, what's one thing that's kind of surprising, I think it's been surprising, pleasant thing from the faculty is just how much you can teach remotely that you may not think. And just as an example, as we know, as you know, we have a large master's DL program in cosmetic science, the largest in the country, with about 150 students in it now. Well, we introduced a new course not this past year, but this was before COVID, on fragrance, and it's taught remotely. So you think if you can teach someone fragrance remotely, I think you can teach almost anything remotely. And as part of that, the instructor, of course, mails almost scratch and sniff cards to the students so they can kind of sniff it as he's teaching it. But again, I think part of this is, how do we be creative on what we can teach? If it's okay, I have a question actually for Christy, if that's okay, Bree. Christy, you mentioned that you're in Tennessee, and obviously, you're a senior VP of operations of a large behavioral health chain of 400 pharmacies. How are you kind of working with the travel requirements in your job with COVID-19? I mean, most of us are kind of isolated in our hometown or city workplace. Are you still like traveling a lot? And how are you kind of checking in on your pharmacies?
No. Yeah, so we just started back traveling, and only I'm only allowing a few of us, really me, and my implementation team that's still opening, because we've still opened 6 new pharmacies during this time. But so the travel is different. So I've been going more places that I can drive, but I feel it's important for me to get out to the field to be able to see how they're doing, not just how our patients are doing, but how are my employees doing. So I'm going out to check to make sure that they have everything they need. We've gotten plexiglass barriers, we've got them the PPE, we're doing health screenings every day. So just kind of going out and seeing what they're doing and how they're doing and how I can better support them. So that's really where we're at. There's only, I would say, probably 4 or 5 of us traveling at this point in time. I think we're going to start having a little bit more travel start the 1st of June, but I have a state-by-state risk and analysis that I do every week to figure out where I can let people go.
Yeah, that was a good question for sure. Yeah, I was wondering, that's not Christy's house.
It actually is. I know, this is my other house, so it was easy for me to come to Tennessee.
That's awesome.
Because nobody's renting it right now. Nobody wants to go on vacation.
I'll use it. Perfect. So some other questions we had ahead of time. How can alumni and partners continue to support the college during this challenging time? So Dean Mack, I don't know if you wanted to talk about that.
Yeah, well, certainly we certainly appreciate it. And it's probably not surprising coming from a dean to say we appreciate it. But one thing that I think, in related to the last question about kind of the environment of fewer applications and schools trying to recruit the best and brightest students, one thing that helps is scholarships. And I know for this coming year, we've awarded $182,000 in scholarships to 109 students. So certainly that helps to have that. And certainly we're trying to shift the focus more on admission scholarships. So again, something that we can offer, because it's, in the 7 years of being dean here at UC, it's completely shifted, where we had really an excess of applicants and we could do a lot of screening. We had wait lists and stuff, where now we've completely shifted the other. So certainly those things help a lot with our college. And as I mentioned before, I think, the research as well, the research enterprise, it ties into our rankings. We're an R1 university, which is the highest classification. So it's part of our central mission of who we are, and certainly trying to support our researchers as well. And this new Research Innovation Fund will do that. It hasn't been announced yet, but we're going to have the first 5 recipients of this fund are going to get some good news next week, I believe.
Perfect, thanks. So we had another question. It was sort of alluding to the fall, but are you able to speak to anything at all about preparing for a potential second wave of COVID later on in the fall?
Yeah, I think, that's the worrying part. I think in many ways, we were kind of spared from this first surge, right? I think, especially here in the state of Ohio, where we had a governor that was very proactive and did a lot of things early on, that surge really never came. But, in some ways we got lucky with COVID-19, right? You think about when it really hit the US, it was kind of the second half of March, when typically flu season would be kind of dying out. So I think the fear is, what happens. And I think many of you have seen on social media probably the graphs of the Spanish influenza as well from 1918 and 19. You see kind of the first little bump and then this huge, massive thing. Now, of course, society is very different than it was 100 years ago, but I think that's the concern of what happens if that. So that actually is part of our planning. We're actually looking at, do we need to change the sequence of our courses a bit? Trying to fit in maybe more things we can do in person early on in the semester, because we could be in a situation where maybe halfway, maybe it's November and we have to shut things down again and move remotely. So we are planning for those kind of scenarios. Associate Dean Brad Hine, who many of you know, actually just did a survey to every single one of our courses offered in our entire curriculum. He communicated with the instructor and kind of said, how could you teach this? Can we be flexible at all? So we are working through those scenarios for sure.
Great. I have one last question submitted ahead of time in our last few minutes, and it'll be a good segue to finish up, but it is about admissions and recruitment. So you've alluded to that a little bit just with that swing, but it seems like somebody knows someone who's going to be applying. So what should students applying for the program consider to improve their chances of getting in? But I think just a more general question about that is, what do we look for in students? How do we look for students who can improve the program and make it more well-rounded of a class?
Yeah, I guess, hopefully this is reassuring to all of you, that are joining in the call tonight. But one thing we have not done, even though it's gotten a little bit tighter, and even though, again, as I said, we're not going to fill the class, we have not dropped our standards at all. And so I think for us, that's been important because we don't want to admit students just for the sake of admitting them and then have them struggle through the program. The one tweak we are doing for this year, and it's really because of a testing factor, we are making, the PCAT optional, because you might be aware that actually right now testing centers are closed. We don't want to hold back students. Actually, the faculty just voted on that on Wednesday this week, so yesterday. So that was actually required a faculty vote. So we're making that optional. But other than that, it's the same kind of level of rigor. They do a full interview. Now those, again, are switching to virtual. We actually, the last few students we interviewed were more of a virtual interview, but as far as the same standards, we have not dropped those at all. So, and I would just encourage, if you know someone applying, have them reach out to Corinne Sams or Lindsay Sturm. They'll guide them, give them tips, and really help them, walk them through the process.
Perfect, thanks. Yeah, and I guess my segue to that is, even in all of this, there are still ways to get involved at the college. We have our alumni and partners help with admissions interviews, and you can host a virtual dinner with Bearcats. There are a lot of things moving forward that we're still going to be able to try to do. If you want to connect with faculty to be a guest lecturer and speak to students of a student organization, we'd love to hear from you all to support the college in that way and stay connected. We also have an alumni council. They meet quarterly and help with our planning efforts and student outreach. So if you're interested in anything like that, please feel free to reach out to me. I will put my contact info here in the chat here when I'm finished talking, but you'll also receive a follow-up email from this. We're recording this, so we'll share the recording in case you wanted to review anything and or share it with friends. So if there are no more questions that I can see, I guess we'll wrap up here, but I appreciate everybody's contributions and thoughts, and thanks again to Dean Mack, Emily, Christy, and Mimi for your insight, and for all of you who are working so diligently to take care of your patients and your communities right now. It's such an interesting time, and we just really admire your courage and your adaptability and just your excellence in everything that you do. So with that, thank you so much for being here, and we hope to see you again soon.
Thank you.
Thanks.
Thanks, Bree.